My name is Jack DePriest, and I've been the program director here since December of 2018. Prior to that, I was an internal medicine program director for 9 years. I've been involved with GME for 29 years. I mean, our focus as a program is certainly graduating clinicians on the road to becoming experts. And so it's a very strong clinical experience, and there is a broad range of pathology, and I think they can expect a very collegial, comfortable learning environment, a very, I think, academic learning environment, and that they'll have the opportunity to work in a healthcare system where every day we're working with, very committed, highly trained healthcare professionals in all of our learning environments. I think one of the things that separates our program is our focus on developing leaders, and that we've created a curriculum to achieve that goal, and focusing on things such as a Myers-Briggs type inventory and workshops on how to utilize that, taking the TKI conflict handling mode instrument and doing workshops on how to manage conflict effectively, and really to make leadership a conscious process, just like we try to teach them to make clinical decision making a conscious process.
My name's Andy Ariza, and I'm in my third and final year of Pulmonary and Critical Care Fellowship. The reason that I came to this fellowship at Prisma Health, this was actually my first interview in interview season, and when I came here I got a really good vibe. The ICU was very active and high volume. The pulmonary attendings that we have here are very passionate about what they do. I knew I would get to see a lot of good pulmonary and a lot of good critical care, and most importantly, it seemed like a very hands-on program, which was very attractive to me. The level of autonomy that you get in this fellowship is partially up to you, as much as you want to get out of it. And for myself,
my name is Amrit Rao, and I'm a second-year Pulmonary Critical Care Fellow. The best part of my experience in fellowship thus far has been getting to know my co-fellows. I think that as a group, they are some of the brightest people that I have ever met, and I feel that in this environment, which is a very stressful environment, having the support of these people is by far the best thing that there is about this program. So I've had the opportunity to work with many strong women in our department that do both pulmonary and do critical care medicine, and they've been incredible role models. Critical care medicine is a male-dominated field. As a result, these women have told me multiple times that women are going to have it harder in critical care medicine, and I've felt that. And as a result, being here and being with these women and getting to know some of our nurse practitioners as well, it's a very empowering environment. And I think that our male colleagues, the attendings and co-fellows, do an outstanding job of making sure that you do feel empowered. During my Pulmonary Critical Care Fellowship, I have had influential mentors. These people are people that I look up to. They go above and beyond. They reach out. They do what I call wellness checks, and for that I'm very appreciative.
Creating that proper balance of work and life starts at the top, and that it needs to be a philosophy and something of importance from the top down. And curricula and the program is then set up to achieve that balance. And a lot of that again is just modeling from the faculty, but we also collaborate with other partners in the institution to do workshops on wellness and to teach them tools to find that balance, and then we assess them as part of their semi-annual review. We check in with their self-evaluation on how they're doing.
I think along the way, one of the things that has inspired me or that has surprised me is now being 1 year through fellowship and looking back at just how much I've grown as a person, and both in critical care medicine and pulmonary medicine, but then also procedurally looking at the level of autonomy that I have and the decisions that I'm making and the outcomes of the patients. And when reflecting on that, it's incredible to see the amount of growth that's happened in 1 year.
I think what I'll remember most about my time here, when I look back on this fellowship, just the expectation that I had and what I wanted to get out of fellowship, how this fellowship really did meet that and actually surpass it as well. Just that I was able to get everything I wanted out of this fellowship and more, and just how grateful I am of all of the great attendings here that all really take the time to work very closely with you one-on-one, give you the autonomy, give you the confidence and the skills that you need to grow and leave here a physician that you're proud of being.